Hi, welcome to another episode of Talking with Docs. I'm Dr. Paul Zalzal.
And I'm Dr. Brad Weaning.
And I'm Dr. Arjun Krishna.
And you know, Arjun, we made videos with you before. They are so popular. Thank you so much. People just love the information you give. We'll be really upset if you get on Ellen DeGeneres before us, okay? So please bring us along.
And remember, in the first video, we joked about Bradley Cooper, and actually Lady Gaga called us and said she wants you in the Star is Born sequel, because truly a star is born here on Talking with Docs.
You're doing awesome, and so we really appreciate you taking the time to join us and all the great work you do getting our patients anesthetized so we can do surgery on them. And that's the topic of today. We're going to talk about what are your anesthetic options if you're going to have an anesthetic for a surgical procedure. Hit it.
Where would you start?
Well, the answer is simple. It depends.
Yes, agreed. Totally.
So it really depends on what the patient's history is, what kind of medical problems they have.
Sure.
And then it also depends, which is probably the bigger category, is what type of surgery they're having.
Right.
So different kinds of anesthetics are tailored for different kinds of surgeries and different kinds of patients.
Okay.
So starting with the most simple form of anesthetic, you can have your surgery done under local anesthetic.
Okay.
So local anesthetic is where we give freezing medicine, like what you have at the dentist.
Okay.
So we numb the area that's right around where you're, so say you're having surgery on your finger, we can put freezing medicine right there at the tip of your finger and then do the surgery right there.
And that freezing is administered with a needle going through the skin.
That's correct. Injection into the skin area.
Okay.
Local.
Local.
That's right. Now, on top of local, you can add sedation, depending on if that's needed. The sedation helps with keeping people calm and relaxed, helping people not remember things, and also for any pain that may be experienced, but unlikely if the local is adequate.
And potentially to not move, because even though you froze their finger, their arm still works, right? So you don't want them to pull away, even if they're worried about something.
That's
Most of our viewers are familiar with sedation just by watching our videos.
Okay.
Sleepy.
That's another form of conscious sedation.
Okay.
Just watch
so we got local and sedation, number one. Okay, what would be like the next level of anesthesia?
So the next level would be called regional anesthesia.
Okay.
So now we've discussed putting local at the site of the surgery. But let's say the site of the surgery is quite large and we're not able to completely freeze it.
Yep.
Let's say we're having surgery on your whole hand. Then we'd want to numb at a higher level. We can put the freezing up, say, in your shoulder area. We get all the nerves that come off of your spine that provide sensation to your arm, and we can freeze your whole arm. So that's called regional because it's a bit distant from the actual site of the surgery. Okay, so the freezing medicine goes here, it numbs your whole arm. It's an injection.
Yep.
And then basically your whole arm's numb, you can have the surgery like that.
Local. Regional.
And regional works because you know where the nerves are, right? So you use an ultrasound, plus you know the anatomy, so you're kind of targeting a very specific area, knowing that if you get it up here, you can kind of stop the downward flow of the nerve signal.
That's right.
Okay.
Exactly.
Got
That's
it.
exactly right.
Number three.
Yeah. So the third option is, again, dependent on the site of the surgery. If you're having surgery in the lower part of your body, you can again have local or regional, but you can also have a spinal anesthetic or an epidural anesthetic.
Okay.
And basically what those are injections of freezing medication in the back.
Yep.
They'll freeze you from essentially your belly or your waist level down, and then you can have your anesthetic without having any sensation in those lower parts. The difference, again, between a spinal and an epidural, we discussed in a previous video, but essentially with an epidural, we leave a little catheter there, a very soft, flexible catheter, and we can continuously deliver medication for longer periods.
Yep.
A spinal is a single dose of medication, one-time dose, and it's a fixed amount of time that it works for.
Okay.
All right, so we've got local, regional, spinal. The
Epidural.
next, spinal or epidural. So local, regional, spinal or epidural.
We're not going to test you, Paul.
Okay.
There's only one left.
That's it. Give us the big
The last
guns.
option is a general anesthetic.
Here we go.
So general anesthetic is full body anesthesia.
Okay.
And essentially it's where you get medication. We start usually with IV medication. The medication is going to make you essentially unconscious. And it essentially will slow your breathing down or completely stop your breathing. And we're going to use a breathing tube and a breathing machine to help either support or completely take over your breathing.
And what's nice about that one is that you could do a really, really long procedure with that, right? Essentially, unlimited amount of time, you know.
Yes.
Okay.
Correct.
So we've got some time. We're in the OR. Can you test all of them to demonstrate on Dr. Weaning so we can really
I had lunch, so it's going to have to be you.
Okay. I'll take the
Yeah.
Okay, so now on the spot, if you had to choose, if you're going to have surgery and you could have any one of those four, what would you pick? It's a good question.
Sure, okay.
Which one would you pick and why?
I would Okay, so my preference would ideally be the least invasive one if possible.
Right,
Okay,
local no
so-
sedation.
Yeah, local no sedation is probably the best option if you can have it.
You guys are laughing at me. You're laughing, but I have a lot of patients that say, I don't want to hear anything. I want to be knocked out completely. I want a
know.
general
You're
anesthetic.
right, they do.
Some people don't like being any way at all awake or knowing they're just partially sedated. They want to be knocked out.
Even if there is greater risk, which there
Yeah.
can be depending on their
They
medical
say,
history
"No, I
or
wanna be
whatever.
I want to be completely asleep. So
Yes.
some people do choose that.
And that's right. I always tell my patients, I know you do too, we always say, listen, it's a combination of what you're comfortable with, but also what your anesthetist thinks is best for you. So it's a group decision that you should be a part of.
Yeah.
But ultimately, when you go to your banker or your lawyer or whatever, they're experts in that field and they're going to make suggestions to you that you probably should abide by
Yeah.
within your comfort.
And that's the whole point of this video. We're trying to educate you enough so you can ask the right questions when you meet your anesthetist. But at the end of the day, you really want to value your anesthetist's opinion. If they give their opinion on something, you really want to listen to that because they're taking the whole story into account and ultimately doing what's best for you.
So yeah, the last thing I'll say though on that is that if the main concern is around being anxious during surgery, we can always, any of those original forms, the local, the regional, the spinal or epidural, we can always add sedation.
Right.
Typically we can add sedation to those.
Without a tube.
Without a tube,
Yeah.
so that you essentially are calm, relaxed, and often don't have a lot of recollection of what's happening during the procedure.
Okay.
You guys have learned so much today, man. You've learned about anesthesia, okay? He
Yes.
went to school for 5 years after medical school, learned about this, and you learned about it in 10 minutes. So local, regional, spinal or epidural, or general anesthetic, those are your choices for surgery. Thank you so much. And you know, because you're so important and we get so many views with you, we actually have a real person filming and not just a tripod. So thanks, Elise.
Yeah.
We did. We put usually it's just a tripod holding while we do it.
There you go.
Hope you feel special.
And if you guys like this video, please like it, subscribe to our channel.
And remember, you are in charge of your own health.
We'll see you next time.